Hi, this is Steve Rowe, Executive Director. Today is Tuesday, December 21st. I'm recording for a video that will be uploaded to you on Wednesday, December 22nd. It feels like this is going to be a pretty short video. I don't have a lot to talk about today. And before I start talking about COVID, I would like to thank Megan Ross and the Oak Notes Choir for the performances last week. I had the opportunity to attend the morning concert down in the studio, and it was just absolutely beautiful. And I know that the evening concert was just as good, and hopefully to a full house. I really enjoyed it. One of the things that I'm very proud of as I talk about our community with prospective residents is the Oak Notes Choir, and I make a special point of talking about this is an opportunity where we have people from all levels within Oak Knoll, independent living, assisted living, and health center residents, all participating in the same activity of creating music together. And it's just such a wonderful opportunity. So again, thank you to Megan and to all of the Oak Notes Choir members. You did a fantastic job. It was great. COVID still not good in Johnson County. At Oak Knoll, we have a handful of staff members this week who are out, either because they have COVID or somebody within their family or maybe even a roommate has COVID. So as a precaution, they're not at work this week. So it continues to affect us from a staffing standpoint with people missing work, either being sick themselves or to quarantine. Within our residents, we still do not have any cases. I am aware of a couple of potential exposures that happened within the last few weeks, and fortunately, neither of the residents who were potentially exposed did ever test positive for COVID or have symptoms. So it feels like we continue to dodge bullets and keep COVID out of our resident population, which clearly is our number one priority. So that we're accomplishing. For Johnson County, the numbers just continue to be much higher than we would like. I've got information through last Tuesday, December 14th, and we are on a very, very slow downward trend right now and have been on that slow downward trend for about a month, but it's taken us from 77 cases down to about the low 60s. So not a steep decline, but just a very slow, gradual decline. The positivity rate also is on a slow decline, and last week it finally dipped below 10% after being above 10% for more than a month. So the positivity rate was at 9.7% when we looked last week. The Omicron variant of the virus is getting a lot of attention in the media, probably rightly so. And I read today that 73% of new cases across the country are from this new variant. So it has certainly surpassed the Delta variant and now is probably the most prevalent form of COVID virus out across the country. That same article also showed a map of different states and how they were affected by Omicron. And the Midwest, for whatever reasons, is just kind of this pocket that really hasn't had a lot of cases yet. And the 4 states that were highlighted were Iowa, Missouri, Kansas, and Nebraska. So that pocket in the Midwest really hasn't seen a lot of Omicron activity yet, but it certainly is on both coasts and probably creeping inwards. And I'm sure, I know that we have it here, but it's just not a huge piece of what's going on yet. Vaccines and boosters do appear to be effective in fighting this, at least reducing how sick people get and preventing hospitalizations and deaths. So that's good news for us so far as we're dealing with this new variant. We just want to encourage you to continue to be cautious. Use your masks when you're out in common areas. If you're in a crowd outside of Oak Knoll, certainly we want you to wear a mask. I know I wear a mask when I go to Iowa basketball games. I'm going to the game, but I'm trying to stay away from as many people as I can, and I am wearing a mask from the second I step into the building. It's kind of alarming how few masks you see in a crowd like that, but it's like at least just want to encourage you to keep being the people with the masks on, and we will keep each other safe that way. One other thing that I want to talk about a little bit, it's like, and another reason to try and stay safe and healthy as much as possible. Over this past weekend, we had a resident who needed to be hospitalized. The hospitals here in Iowa City, both University and Mercy, were full. That resident also, well, it's like I don't know this for sure, but it's like I'm assuming that the hospitals in Cedar Rapids were also full because that resident ended up being hospitalized in Waterloo. That certainly is not an ideal situation for a family to get back and forth to be with their loved one. And I'm assuming that only happened because that is the closest hospital bed that they could locate. So please stay safe, stay healthy as much as you can control it, because hospitals are just full right now, and it's not entirely COVID, but that is certainly a very large contributing factor. That's really all I have for you today. I hope things are going well for you. However you celebrate the holidays, I hope you find peace and joy in these next several days, and just hope that you're all doing well. Take care.